my name is Daniela.
I'm Laurel.
I'm Lanica.
And our name group is
Two Fairies. Today we're going to be doing this video to show you guys the process of sterilization in the dental office.
So once we have discharged our patient, we're gonna come back to the room, we're gonna wash our hands, and we are going to put all PPE on, and we are going to make sure to put all the instruments that we have used into the transportation box. Once we have put everything in, we're gonna make sure that it is completely sealed, and we're gonna head over to the sterilization area.
So once we get into the sterilization room, we're going to pre-clean and disinfect our tray and then put it on the clean side of the room. This is the contaminated side. And we're going to take our instruments out of the box and load them up into either the ultrasonic or the hydrum. The hydrum is like a dishwasher for the instruments. It'll rinse and wash the instruments. This one takes about 34 minutes. This one has soap and everything in it. And then for the ultrasonic, it takes 15 minutes. And we need to fill it up with water to the line and add 2 pumps of our cleaning solution and make sure the water is clear. And once we load it up, we have to make sure that all the items are completely submerged in the water. Anything that isn't in the cassette will be going into one of these plastic containers. So that it's not just like floating in the ultrasonic. And once we load up everything, we close the lid and we start it for 15 minutes. And if we're using the hydrum, we can click this P3 HD wash, and then it'll take about 34 minutes. And everything is washed and all the debris is off and everything. We're gonna come to the sink. We're going to take this out. Drain the water a bit. And we're going to rinse off the items to make sure all the debris is off and everything. And then we're going to dry all the instruments and package them up for the autoclave and sterilization.
So after your instruments come out of the ultrasonic cleaner, we're going to dry them, and then to prepare them for the sterilizer, we're going to either package them or wrap them. And this packaging and wrapping helps ensure event-related sterility, which just means that once the instruments come out of the sterilizer, they're going to stay sterilized until you're opening that package or something compromises the packaging. So to ensure that everything is sterilized in the sterilizer, we use sterilization monitoring. There are 3 different types of sterilization monitoring. The first is physical monitoring. So we're actually going to look at the physical sterilizer, and we're going to check the different monitors on the sterilizer, such as the temperature indicators, to make sure the conditions have been met for everything to be sterilized. The next is we're going to use chemical monitoring. We have different types of chemical monitoring. These chemical monitors will go on the package. Inside the package, we have color changing strips that will change color to indicate that conditions have been met inside the package for sterilization to occur. We have color changing tape that will seal the package. And also on our little plastic packages, they come pre-made with color changing material on them. So you should always check those when they come out of the sterilizer to make sure sterilization has occurred. Label it with your name, the date, and the sterilizer that it's going in.
So once the instruments has been packaged and they're ready to be sterilized, we are going to get them and go ahead to the autoclave machine. Before we place any instruments in the autoclave machine, we have to make sure that the water levels are in the green side. If they are lower on the red side, we have to make sure to pour more water into this hole, and it has to be distilled water. It cannot be tap water. Depends on the manufacturing instructions. We are going to make sure to place the instruments facing up or facing down, so the actual steam goes through the package and steam the instrument. And we're gonna go ahead and place them into the machine. Once we have placed everything into the machine, we have to make sure that it's completely sealed, and the way to do it is we have to make sure to lift this up, making sure that this is completely into this hole. We're gonna push it down, close it, and making sure that it's completely sealed. We also have to make sure that once we load the instruments into the tray, the instruments are not able to go on top of each other, because it won't be sterilized. It won't go into the instruments. Once the autoclave has been completely sealed, we're going to the control panel, and we're gonna choose the correct option of the instruments that are inside. If they're unwrapped, pouches, and depends on that, the machine will get the timer, this exact time, depending on the option, and we're gonna go ahead and do the start. Another machine that we could use for sterilization will be the Statum. The Statum is a faster machine that it will help the dental office to sterilize the instruments much faster. This can be used between patients because it's only going to take between 8 and 11 minutes, and for manufacturing instructions. This is the Statum. What we see over here, as any other sterilization machine, we have our cassette where we're gonna place all the instruments, as well as where we are going to put the water in. This water is where we're gonna place only distilled water, and it goes over into this bottled water. This condenser, as we're able to see, has 2 different lines, and for the Statum, the water needs to be between these 2 so it actually is able to work. Once we place the water and we put the tub, now we are able to place the instruments in the cassette. To be able to place the instruments in the cassette, we need to make sure that they're not on top of each other, and we also need to make sure that it's completely sealed. And to be able to insert it, we need to make sure to hear a click. For this type of machine, we are able to place instruments that are grab and ungrab. This is the panel where we are going to select the correct load, if it is grab instruments, and we're going to select the start. In this machine, in this panel, we are also able to see if there is any error that the machine is going through, and the machine by itself will shut down by itself and will let us know in this panel that is having some issues, and we are able to find more information about the issue in the manufacturing instructions.
Routinely use physical and chemical monitoring. Biological monitoring is the only way to be sure that sterilization has occurred, and testing must be done weekly to ensure sterilizers are working properly. 2 types of biological indicators are used for spore testing. Geobacillus stereothermophilus is used for testing steam, chemical vapor, and hydrogen peroxide sterilization. Bacillus atrophaeus is used to test dry heat or ethylene oxide gas sterilizers. Biological indicators come in the form of spore strips or self-contained vials. Spore strips are paper strips that should be packaged and processed through the sterilizer on its normal cycle. Once it comes out of the sterilizer, the strip should be placed in a tube of culture and incubated. If the liquid in the tube becomes cloudy or changes colors, that indicates the presence of live spores and sterilization failure. Self-contained vials should similarly be processed through the sterilizer and then squeezed in order to break the internal ampule, which mixes the growth medium with the spores. The vial should then be incubated according to the manufacturer's instructions, and if the liquid in the tube becomes cloudy or changes colors, that indicates the presence of live spores and sterilization failure. The dental assistant should record the date of the test, type of sterilizer, temperature, and time of the test in a manual in case sterilization failure does occur. That way, one can easily identify the load that needs to be reprocessed and the sterilizer that needs to be taken care of. Some states also require documentation that biological monitoring is performed regularly in the dental office.
After each sterilizer use, we need to record the processing and load results. On the sterilization log, we need to put our name, date, time, and which sterilizer was used, and whether it passed or failed the sterilization process. After all the cassettes and instruments have been sterilized, we need to place them back in the designated area to return to treatment rooms. We're going to place the cassettes in this shelving right here, and then we're going to move the instruments and put them in this cabinet on the clean side of the room. Once we are done using the ultrasonic cleaner, we have to empty it and wipe it clean. When filling it up, we have to close the water valve by pulling it to the left, but when emptying it, we have to pull it to the right so the water and cleaning solution drain out. Once it has completely drained, we need to give it a quick rinse with water, then we're going to wipe it clean and prop up the basket at an angle, leaving the lid open so it can further air dry if needed, and it is ready for the next day. At the end of the day, we have to make sure that all the sinks and countertops are pre-cleaned and disinfected using our disinfecting wipes.